Hiral Shah, and I think we have quite a few times I have come over here, and today I am going to discuss on heart and heart related issues, and particularly post treatment heart related issues. Now, what do you mean by post treatment heart related issues? If somebody has a heart problem, say an attack condition, or they have a swelling, or they have some of the other heart problem, blockage kind of problem, then there is a set mindset, and generally people go for bypass or go for CABG or go for PTCA stenting, they go for. Okay. Now eventually we have seen that after doing all these things also, there is a set of people who have got cardiac relapse, cardiac problem relapse is there, and generally whatever treatment, conventional treatment they have carried out, either operation or whatever medicines they are taking for heart, are not satisfactorily giving result to them. They have some complaint, they have some to a good amount of complaint kind of, and many a times doctor advice for another bypass, another stent. If they have multiple blockages, then they have to go for twice, thrice, 4 times they have to go for stenting. Okay, and still they have complaint. And generally their life it is restricted to house, so generally they become paraplegic kind of, semi-paraplegic kind of, and their the regular routine life is lost. In fact, they are constrained kind of. So why this happens? Why the conventional treatment, why the operation fails, why the stent fails, or why the medicines they don't give you full results? And what if these things have failed? Now what is next to it? Okay, generally they have to keep on taking heavy doses of chemicals, heavy medications. If you see any heart person who is taking, they are taking blood thinners, and they are taking that angine, antiplatelet and anti-clotting and blood, lot of medicine, around 20-25 medicines, list of 20-25 medicines prescribed to them. They are taking more than food, they are eating medicines. That is the condition who are having any heart problem. Now first of all we see that what are the factors responsible for giving you heart problem. Now we'll say that heart problem is only and only your diet and lifestyle problem. You forget about that 1% congenital problem. We are not talking about that at present. We are talking about the society at large, or the masses who are suffering from heart problem today. Diabetes, hypertension, these are the background for the heart problems. Now again we see that again this diabetes and hypertension and cholesterol, and these are again your lifestyle and food related problems. So ultimately we come to your lifestyle and food only when we talk about heart problems. Now what I mean by heart, lifestyle and food. If you remember, when we were children, our parents used to always advise, particularly moms used to advise, that you have to eat everything. Okay, all rasas, all bitter taste, bitter rasa or the sweet rasa or everything you should be eating. And if a child is not eating, then parents used to forcefully make them eat all whole food kind of. Okay. Now this has been concept we are following for last many years, or you can say many generations we are following this concept. Is it actually true? How the seeds of the heart problem or the seed of the systemic problems are sown? Now if we just look behind and see, if some children, if you forcefully feed the milk, or if you forcefully feed wheat or some products, they will vomit it out. Okay. Now what do we think of it? We say that the child is not liking it, and if he is not going to drink milk, or if he is not going to eat this particular food, he is going to suffer malnutrition. He is not going to get protein or vitamin or whatever it is. But eventually in last few years our dietetic research has shown that body has its own particular type, and that type is that from your birth. So your body can digest particular set of food, particular type of food, and body cannot digest particular type of foods. Now if you are forcefully fed that particular type of food, and eventually you keep liking that particular type of, and you have a habit of eating that kind of food, that food is particularly not getting digested in the body, but it is causing free radicals, or we call it particularly as disease causing factors in your body. This is from the childhood we are getting. See, person who has got a heart attack and who is found with 100% blockage, that 100% blockage doesn't come all of a sudden. That blockage must have been 1% someday, 1%, 2%, 3%, 5%, 10, 50. Then it has reached to that level of clogging the blood completely. So how it has reached and why it progressed, why it didn't stop by itself, and why everybody is not suffering, why particular set of people are only suffering. So the basic roots are how we are and what we are eating, and what we are eating from the childhood, what habits we have acquired. So our kitchen, particularly parents, particularly mothers, wives, they are directly or indirectly responsible for your health. Now what if we identify that this particular food is responsible for creating all this set of diseases? What do? We will avoid that food completely, okay, and we will be changing our lifestyle, we will be changing our food pattern, we will not force children to eat that, or we ourselves will try to avoid that kind of food. Now this is one aspect. Now second aspect is the adulteration as well as metallic infusion. Okay. Blockages are there in each and every person. Dr. Desai, who have done research on this, he says that in India around 120 crore people have got blockages in their body. That means the whole population has got blockages in their body. Okay, if you randomly select people and if you do angiography, you will find that almost 90% of them will come out with the blockages, and they will not be having any cardiac problems, or they may not have any cardiac problems in future also. Okay, still they will be having blockages in their body. That means what are blockages? Blockages are body's own repairing system, healing system. When a skin is cut, there is a fibrosis. The fiber tissues, they sew up your skin. Similarly, whenever there is a damage inside the body, whenever there is a damage of the blood vessels anywhere, of the heart, of the brain, of the feet, anywhere, the body repairs of its own. Okay. Now this repairing material, basically when it clogs, it starts clogging the blood vessel and it starts thickening the blood vessel, then the lumen of the blood vessel, it reduces in size, and we call that as a blockages. Still it is not a problem. Still it is not a problem. When the problem starts, when this thickened wall starts becoming hard, till they are soft, the blood can easily pass, and till the blood circulation is not hindered, you do not have any cardiac problem. But when the cardiac problem actually exhibited by the body is when these blockages, they start becoming hardened. So how the blockages get hardened? This blockages basically, or the repairing of the blood vessel, is done by some soft tissues or the softest thing, something like cholesterol. Cholesterol is utilized to repair the wall of the blood vessels. Okay. Now if the cholesterol is not available, if the cholesterol is not available in enough quantity, or there is a severe kind of damage of the blood wall of the blood vessel, then body has to use either the fibrous tissues, or last resource is the calcium or the metals, and they are deposited metals. Yeah, free metals. Body uses this calcium and the metal to clog the leakages or thicken the wall of the blood vessels so they don't tear up. Okay. Now Why? What do you mean by cholesterols are produced by our own liver? Okay, so how we are deficient in that? So, whenever there are damages in the body produces cholesterol, the cholesterol level increases, and when we test our blood that time, we will find that we have high cholesterol, high triglycerides, LDL is gone up, okay, and this blood picture generally leads us to take anti-cholesterol medicines. So what do? We take anti-cholesterol medicines, we take anti-blood pressure medicines, and our blood picture is again corrected to some extent, not fully extent, to some extent it is corrected. Now what is happening? The body is lacking its natural repairing raw material to repair the blood vessel lumen. Now the soft material is less in quantity because we have used certain chemicals to stop the production of that. Okay, so we are hindering the production of that, and we are not attending the damages of the blood vessel. The damage of the lumen is not been attended. So what is the option for the body? Body will utilize fibrous tissues and clog it. So that soft blood vessel now with the fibrous tissue will start becoming hard. That's atherosclerosis. And still if that is a problem, still the damage is more, body will start utilizing calcium and metal, free metal available, whatever, and start depositing in that area, and it will harden it. So 100% of the blockage which is soft in nature will not bring heart attack problem, but 5% of the block, 5% level of the block which is hard in structure will definitely invite the heart attack condition. Okay. So this is the blockage part of it. Now there are other problems also along with that, the cardiomegaly, or there is you can say the pumping or the EF is low. Now whenever the EF is low, pumping is low, okay, the patient's condition becomes inoperable kind of. Below 40, 35 EF, it's called as cardiac failure condition, and this cardiac failure condition generally becomes inoperable condition, and by no way no chemical helps in increasing the EF level. Okay, it's a muscular problem basically, the pumping problem, the valvular problem kind of. Now eventually we have seen that there are certain ways and certain non-chemical formulations can help to increase the EF. We have cases from 10 EF which has gone to 40, 45, even 60. 60 is the normal level, 60, 65 is normal. So from 10, 15 which are severe, even if they walk for few steps also, they have heavy breathing and all the cardiac symptoms they start. Now from this condition we have seen in and around 4 months, 5 months, 6 months, over a period of 1 year, they can come back to their normal EF and they can live normal life. And another thing we have found, one factor which adds on to this low EF condition is the metallic infusion, chemicals and metals. It literally brings down your EF condition. And particularly what we have seen, that people who have got metallic teeth implant, they have low EF problem, or they have relapses of the cardiac problem. Now I am talking about why your cardiac medicines become resistant or they give less result. Some people you give whatever the set of medicines are available, you give them and they are better with that, they can live their life. But some people after taking this medicine also they have problem, or they have more problem with medication. Okay. Now why? They already have severe infusion in their body, some toxin, you can say that some disease causing factor or some free radicals are there in their body which is aggravated or irritated by chemicals. So you take medicines and you have more problem kind of. And this particular metallic infusions, particularly the metal implant, or if you are using aluminum vessels to cook, people who eat outside, you will see that even in best of the hotels, the big vessels are of aluminum. And aluminum is a soft metal, it reacts with everything, it reacts with water also, because our water is chlorinated water. So it's acidic kind of. Okay, so mild acid, mild alkali, little bit of lemon or tomato or anything you are cooking into it, it reacts and there is a leakage of infusion of chemical or the metal in your food, and what you are eating basically is you are eating metal part of it, more of the metal part of it, and this soluble metals now gets inside your body and get deposited in your brain, in your thymus, in your liver and in your heart, in your kidney, everywhere it will go and it will harden, it will accelerate the atherosclerosis process. We are traditionally drinking that tamba pani. Okay. Now what is the concept behind it? 50 years back we had deficiency of metal because we used to store our water in earthen pots. We used to use more of the earthen pots to keep everything, or the cook also earthen pots only. In last 50 years we have transformed from well water to the pipeline water. Now pipeline is lead pipeline, okay, and our all cooking and storing vessels are metal vessels. And in that, if we are using, instead of stainless steel, if we are using aluminum or tamba pani or whatever kind of, this kind of water for keeping, storing or cooking, this metal is dissolved. These are all soft metals, aluminum, tamba, pittal, chandi, silver, these are all soft metals. They get dissolved with acid, mild, light, alkali, mild alkali and mild acids, they get dissolved with it. So we have more of the infusion. At the same time, all the ready-made foods, sausages, chutneys, packet food, they have biscuits, breads, everything have got preservatives and they are all metal base, all metal salts. So we have more and more metal infusions. At the same time, what the pesticides and fungicides and whatever chemicals are sprayed on the, they are also metal based. So you can find out from morning to night, right from using your toothpaste, you find out what preservative they have put into it. Keep on adding, you will find that unknowingly you are putting lot of metal in your body, and that also in soluble form, which will get absorbed into it and it is freely available to deposit in your blood vessel and in your brain. Why Parkinson's are more seen in people of that particular thing. Alzheimer also, and you will find that this Alzheimer's and Parkinson's and this kind of diseases are seen in upper middle class and upper class more. Why? Okay, because the food habits, ready-made foods and this kind of habits, basically easy lifestyle is making them more exposed to the soluble metals, and these all metals, they go in our systems and they keep depositing and produce lot of disease causing factor or the free radicals kind of, they accelerate, the trillions, billions and trillions radicals are there in your body. Now these are the factors which actually not allowing your medicines to work, okay, and you are putting chemical to settle something, you have already lot of chemical inside your body, so it exceeds, okay, and then you have the either the medicine do not work properly or you have another symptoms or you have some other things or some other problem, like if some people, there are some people who take sorbitrate or some other medicines, they get headache. Okay, it's not that the medicine is actually causing the headache, it's that they already have problem inside their body and that little bit of chemical which was supposed to help them is actually creating problem for that. So this is the picture, if you see in short, with the chemicals or the medication what they are taking. Now this we talk about the extrinsic factors, means the factors outside or the environmental factor which are responsible for giving us some or the other problems and which are leading to the heart diseases. Now there are certain intrinsic factors also. Intrinsic factors means the factors which are generated in your body itself. In my last few programs I had talked about the acid cycle. Okay. Now acid cycle, the timings and your hormones. This constitute basically the internal environment of your body. If your body environment is more of the acidic side, then you have the way you get acidity in your stomach, the burning problems and uneasiness and the ulceral problem, this kind of problems, the way you get it in your stomach, the similar problems are there in your blood vessels also, because blood vessel or the blood also has its own pH. So if that is altered, then the biochemistry is altered, and if the biochemistry is altered, then you have some other problems. Similar kind of blood vessel erosions, or similar kind of, we have a C-reactive protein test kind of, if the internal lining of the blood vessel is damaged or there is a damage to that, the C-reactive protein test generally comes positive with that. So what do? So we try to balance it with some antacids, okay, some internal infusion of the antacids, or you take antacids from outside, or you take some water which is alkaline in nature. Now what is the problem with all these things? Why they are not working? Generally today's topic is that after Plasty, bypass and other traditional or conventional medicines, why there are problems. Okay. So when we talk about food changes, or when we talk about some antacids taking or some systemic thing to balance your pH and all, why they are not giving you result? The reason is that if we only take example of our digestive system, in your mouth the saliva is alkaline in nature, in your stomach the acid is acidic, again your intestine is alkaline, again the lower part of the intestine is alkaline in nature. So you have alkali, you have acid, you have alkali, you have acid. Now if you have taken one antacid, okay, what will happen? Here the alkalinity will increase, so you have problem here, the acidity will reduce, but here it will increase. Again in the intestine, when that chemical will go, alkalinity will increase again. At the end there is acidity, so that will reduce. So you are trying to correct that problem mechanically. What is happening, that this is not completely acidic. So when you are taking an antacid, somewhere the pH is increased, then normal, and somewhere it is going down, it is normalizing. Again at the second part the pH again disturbs. Again so particularly the antacids and other medicines, they are also not working, because body's biochemistry is not one, it is different at different places, and whatever medicines you are taking, whatever chemical you are taking, is, if it is not targeted to that particular tissue, and if it is going through blood or if it is ingested, then you have various biochemistry at various places, and it gets either distorted or it changes. Here it will correct, but at 3 places it will disturb. So there is another problem with that. Okay. So we see that the person has to keep on taking or keep on changing their medication, and still they keep on getting some of the other problem. Okay. Now what do we do when we have this kind of problem? First we see that I said, if the basis of our science is that if we take or if we correct our biochemistry naturally, then most of the problems are solved of its own. Even post-operative medicines which are not working will start working on the person. We have seen that the diabetes medication or the cholesterol medicine which was not controlling their cholesterol or not controlling the diabetes will start working once your body biochemistry, your body's natural cycle is re-established, and it will start working again. Now if we talk about Plasty and bypass, blockages, kind of blockages, they come and go. If the Plasty is done or if the bypass is done, what we are doing is, in case of Plasty, the spring, whatever it is put, will only open up the lumen, that is it. But the process of creation of the blockage, the process of thickening of the blood vessel will not be altered or it will not be changed. So what will happen? After few days, if you are living the same lifestyle, if your blood biochemistry is disturbed, if your food is disturbed, at one place you have done Plasty, just below that or at other places again a blockage will erupt. That part will get damaged and body will start repairing that part, and you will have a blockage over there. Okay, and again if you are eating the similar foods, metallic infusion, etc., etc., then that blockage will again become hard and you will be at the square one again. What happens in bypass condition? Bypass is the condition you are bypassing that blockage. You are just giving one blood vessel and bypassing that blockage, and you are not doing anything for that blockages which are originally there. So they are there. Only thing is blood flow is established. But we have not checked or we have not tried anything to stop the formation of the blockage. Again, body biochemistry or the body food habits or the dietetic conditions, if we have not checked, this bypass is also failing because of that. Otherwise, plasty or bypass should be the end, it should be the solution to your problem. But the new blockages, eruption, nobody is giving the guarantee. Only your lifestyle and your dietetic care can control, no medicine can control. Same blockages will also get blocked because it will become hardened. Okay, and that spring, whatever is plasty it is put, that will become blockage in 1 year by itself. It will become hardened. There will be clogging in that also. Okay, and then there will be, we have patients who suffer because of that. After that, and there is no way you take out. You cannot remove that. You cannot remove that. And they suffer like anything. They have peeling. It's a permanent problem then. It's a permanent problem. There is no solution. In fact, it's a worse problem. The problem after this is a worse problem. So, how we can help these people? Dietetic care, lifestyle changes, these are the two main solutions. And if the blockages are hard, or if the blockages are metallic infusions are there, or if the blockages are calcified, calcification, nothing can remove calcification of the body. It's the last resource. Body has clogged it with calcium. It has built a wall over there so that it won't tear it up. Okay, that is the last resource body has used when something is calcified. No medicine, no operation, nothing can remove that. Okay. So how we can help these people? In general, we have seen that if dietetic corrections, if acid cycle, and if their food, body type food are corrected, then there is a reversal of these blockages. The way blockages they come up, the similar way body can handle those blockages to disperse also. So the thickening of the blood vessel. So for example, if you are hurt and there is a swelling, and once you are recovering, the swelling will go off its own. Similarly, blood vessels, wherever there is a damage or wherever there is the blockage kind of problem, okay, body will itself will take care once your body biochemistry or blood chemistry is repaired or it is re-established kind of. So your food habits, your food itself, and your lifestyle. Now what do I mean by your lifestyle? People who eat late will have cholesterol problem. People who eat late will have diabetes problem. People who eat late will have acidity problems. People who eat late at night will invite heart problem. This is the rule of the body cycle. So particularly night food is to be avoided. We stop each and every heart patient who step into our clinic, we stop dinners. We ask them to finish the dinner before 7 o'clock, 6:30, 7 o'clock, the dinner should be over. And they are not allowed to eat anything till next day morning. They are not supposed to eat anything. Let whatever you have eaten get digested completely, and eventually you will find that most of the heart angina or heart problem or attacks, they are there early morning or at night, most of them, and that is because of the evening late food, undigested food is giving the trouble. And by eating early, what is happening that by the time it's 11 o'clock or 11:30, most of the food is digested. So any problem which was supposed to be there will be in that particular time when you are awake. Okay. And generally when you are when the things are digested completely, we have seen 90% of the time the pain subsides just from day 1. They start feeling good, day 2, day 3 they start feeling light also, angina pain. I am not talking about the medicine effect. They are taking the regular medication, still they have problem. But when we change just their food habit, then the same problems get settled just in 2-3 days. This is it. Number 2, their body type food. Now each one has I can only talk about it. I had talked more about it basically in our last. Now we are there to help people. If they come to our clinic, we are there. In fact, the service is free of cost. We help them to find out what set of food they are compatible with. There are certain tests we do, some blood test also some we require, and we help them to find out what type of. So this becomes preventive as well as post operation preventive also. Otherwise there are relapses. If that is not corrected and you are living the same lifestyle, then there are full chances that you get the same problem just in a year or so. So if you want your PTCA, your Plasty or your bypass to be successful, you need to change your food, you need to change your lifestyle, you need to have your body type food kind of. Okay. And 4th thing, metallic infusions. Okay. Now the doctors, they have, if you will see that, you will get lot of references on the internet to the connection between what is the heart problem and the metal in the used in dentistry kind of. So there are non-metallic are available, implants are available. You can use that non-metallic implants. Okay. And if you have metallic implants, no matter what expense, they are expensive. Yeah, non-metallic. Cement is not metal. Ceramic is not metal. Okay.
Nowadays
they use ceramic or zirconium or some other things are they are using. The one which is coming in contact with the food is more dangerous, because it is constantly, your saliva is alkaline. What you eat, a juice is citric. Anything you eat, your vegetable, fruit, everything is citric.
But what about root canal?
Root canal, it is there inside. The food is not coming in contact. Okay. So 90% of the problem is with your metal exposed.
But bridge is metallic again.
Yeah. So you have to take care of it. There is non-metallic available. Now there is non-metallic also available. And you have to find out the option for that. Otherwise you are inviting problem. Also you have to take out all chemical or you can say metal vessels which are soft metal. We use stainless steel or glass or compatible things with non-metallic things. Okay. And aluminium and that tamba pani, we have eventually seen that almost 30-35% of the patient who are 60 plus, they are used to drinking that water who come to our clinic.
They are not aware
every day they are taking. It is toxic. It's toxic. Copper deficiency was there 50-60 years back. So you required. Okay, but now it is in excess. It's so much in excess that even it gives you joint pains and it gives you all kind of pains and lot of problem, including the Alzheimer's and Parkinson's. All these things are also because of these problems kind of. So the chemicals, you list down the things and you can reduce the infusion of metal in your body. This is the solution: change of lifestyle, change of food, your body type food, and reducing metallic infusion. And you will find that drastically things improves, drastically. There was a person whom we treated basically. These are the people, they are having low EF, 10 EF, 15 EF, and eventually we found that 90% of them were having metallic infusion. This particular person was having 16 metal implant, 16, and we didn't knew that time basically, and he was treated successfully, non-invasively. We treated with our medicines and non-invasive treatment and all. His EF also came up a little bit, but little bit only. With 15 he was with 15 EF, normally 60, and 15 is very low, very low. And in 6 months all his cardiac problem relapsed, all his cardiac, same kind of pain and angina and breathlessness and same kind of problem. Then we found out that he had those implants, 16 implants, and we made him to remove all the implants, and just 3-4 days his whole cardiac symptoms started dropping down. Almost a week or so he started remaining normal, and eventually in 3-4 months his EF also improved with that. So your lifestyle, your food corrections, and chemical infusions and metal infusions, this together give you a set of problems, okay, and it leads you to the heart problems. Okay. Any questions you have got?
Just now you said also that you should not drink water in the copper glass. You need to say that nowadays we are getting copper in all other different forms also.
Copper internal lining, copper lining, or the copper glass, avoid taking that.
And you mean to say steel is the best?
Steel is non-reactive. It is found. Stainless steel is non-reactive. See, if you cook something into that, it will stick to it. It will get burned.
Yes,
and if you use aluminum vessel, it will not get burned.
Yeah, right.
Okay, why? Because the thing is same, but the aluminum being a soft metal, it get dissolved. That layer get dissolved in the food. So you don't, the vegetable or anything doesn't stick to it.
Those are also bad.
Non-stick, if non-sticks are
We
good,
don't know really what chemical they use.
non-stick, if you have one scratch, then they are bad.
Then they are right.
That non-stick black material will also be toxic if that is it's going in your body, and below is the aluminum. Now we are getting ceramic coated non-sticks, and non-stick vessels to be handled carefully. There should not be scratcher because they are made up of aluminum only. So when you are using it, just see that they are in good condition. You are not supposed to give it to no. You have to be of your own. You have to take care of your own vessels, particularly non-stick. Yeah, plastic is also a chemical. PET basically at normal temperature is fine, but PET is in fridge, or PET or anything, any plastic thing in microwave also, or any plastic thing which you put, any hot thing or any cold thing, will infuse chemical, and it will give you a hormonal problem. All hormones will get disturbed with that.
Frequently, and
You have to, and it should be normal temperature only. All the tests are done and approved at normal temperature. But if you can find a lot of things on internet also, even best quality type plastics also, if they are in the fridge or if they are something hot is put into it, they infuse chemical.
No, because there are some advertisement microwave plastic that
You go to their site, they declare.
Acha.
If you go to their site,
हाँ, हाँ.
they declare. Even Tupperware people, if you go to their site, they have declared on the site that there is problem when you heat it. Even though they said that, I have checked it in their site also, they are good enough, I mean bold enough to declare that we have problem.
So best is
Glass or steel
Or steel.
or earthen pot, ceramic pots.
Glass based. Glass.
Okay, that is to be used. Kind of.
Very different.
Even I mean silver.
And nowadays the earthen this thing is also coming. Tawa, ye sab. That is I think good.
That is also you can utilize.
So, silver, copper, everything is not.
Silver, copper, they are all soft metals. They react with water also because it's chlorinated water. So they react with that
Till now
also.
people have praised only copper, drinking copper.
That is why we have,
With,
that is now we have, you will find that cholesterol or blood pressure or diabetes or heart problem is there in everyone's house. Each and every house you will
This
find.
is common now.
It's common.
BP and diabetes are
It's common. It's common. And they only lead to heart problems.
Now that's a birthright.
and body needs some point, I don't know exactly, point something mcg.
ppm, ppb level. Not more than
very,
that.
very
Not more. They are there enough in food.
Yeah.
If you are eating palak or if you are eating vegetables, they are enough of minerals are available. मिल जाता है. And when you cook that palak in an aluminum vessel, then you have tons of thing going inside your body. You need to, because I had conducted one seminar in one school with the children of 11th standard. Now can you imagine, they are fun loving, 11th standard, 15, 16 age. Okay, so we all started with fun. I said this is not topic for them, so I started with their topic, fun. And eventually they realized that I made them test their own few things, and out of the 200 students, only 10 people were healthy, only 10. And they actually realized they have problem, hair fall problem or pain problem or this problem or sleep problem at the age of 15, 16. 90% of the children were having problem. So it's lifestyle.
No, because hardening process starts.
Hardening
at the,
process, right from your,
7, 8 age,
yes,
maybe 10.
yes,
It's already started.
yes,
And by our age, 70% blockage is already there.
already there. So that is. Okay, thank you so much.
Thank you.